Please welcome Boulder, not native, but currently Boulder citizen, Dr. Izabella Wentz.
Say oh, you say I say revolution, and you say ja. I say no, oh, you say I say revolution, and you say ja.
So, I have a confession to make. I haven't always been interested in the thyroid gland, especially not during pharmacy school. I thought that thyroid disease was just something that everybody got once they got older. And quite frankly, at the pharmacy, when I was dispensing tons of thyroid hormones, I never quite understood why people kept complaining about symptoms when they were already taking medications. It wasn't until I was diagnosed with Hashimoto's thyroiditis in 2009, after almost a decade of some pretty debilitating symptoms. So today I'm going to share with you a little bit more about thyroid disease and how we can address it, as well as how it can masquerade as mental illness. So I'm 18 years old. I am coming out of my freshman year in college, and I go home for the summer. I'm a little bit beat down and a little bit depressed. And one of the reasons was because I missed my final exam in chemistry. Now, this probably wasn't that unusual that a college student would miss a final exam, except for me, that was really unusual because I was, a straight A student. I was a very type A person, and I got my stuff done, right? Yet, I missed my 9 a.m. exam. And the other part of it was that I just laid down to take a nap at 3 p.m. the day before. And so, what was at the root cause of my fatigue? Right? I go home for the summer with my tail between my legs. I'm going back to the Chicago suburbs where I'm from, and my parents just didn't say the same Izabella again. They said, wow, you don't really care about much of the things you used to care about. You are sleeping all the time. You are, you're forgetting stuff. What's going on with you? And so as any loving parents would do, they sent me to a psychiatrist, right? And I was diagnosed with severe depression. Very severe depression. Like, they were concerned about me, and they were, they wanted to put me on suicide watch because they were so concerned with what was going on with me. Now, going back to my health history and my health timeline, what was going on before I got sick, right? Before I started having all these symptoms. And of course, I think I had a couple of boyfriends break up with me, so that always happens in college, and I missed an exam, and that was very, very hard for me. But I also had the Epstein-Barr virus, or mono. And that is a known trigger for thyroid disease, and that set me on a path of misdiagnosis for almost a decade. I was misdiagnosed with panic attacks. I was misdiagnosed with anxiety. I was misdiagnosed with major depressive disorder. And this is what happens to people with thyroid disease. They're told that they're either crazy, perhaps that they're lazy, like I was because I was sleeping all the time, and sometimes they're just told that they're fat, right? Because they can't seem to pull off the weight no matter what they do. And so many times, some of the root causes of thyroid disease may actually be, some of the root causes of mental health illness and mental health symptoms may actually be due to thyroid disease. When we are all taught in schools, if nursing school, pharmacy school, medical school, we get this picture of a woman, right? This is probably like something you've seen in a textbook before, where half of her is hypothyroid and the other half is hyperthyroid. And so you have this woman that is dealing with symptoms, and one half of it is, hypothyroid, so you've got the sluggish metabolism, you've got the hair loss, you've got the brain fog, and you've got the weight gain, right? And then on the other half, you have somebody who's hyperthyroid. So you've got palpitations, you've got panic attacks, anxiety disorders, the bulging eyes, and just overall like speeding up of things. But the truth is, usually this is an advanced stage for people. And most people who have Hashimoto's, which is what I had, might have symptoms from both sides. So I not only had a sluggish brain, but I also had anxiety. I not only had weight loss, that was actually my symptom, but I also had the brain fog, and I also had the cold intolerance. And it was, missed for many, many years. So I kept getting the same kind of runaround. So, I think it's in your head. Maybe you need antidepressants. Maybe you need anti-anxiety medications. I think you're just getting older. I was 25 at the time, so. Yeah, and this is the message that most people get. Now, when I first got diagnosed with Hashimoto's, it was 2009, and my symptoms started in 2000. This is my loving husband, Michael, who's been with me, supporting me all along the way. And when I first got home from getting my diagnosis, I go, I have Hashimoto's, and Michael said, that sounds like an exotic Japanese sword fighter, like what's going on, right? But this condition, this autoimmune condition that happens to impact the thyroid gland is actually quite common. So studies have shown that up to 27% of our population actually has Hashimoto's when using advanced diagnostic methods. Now, during those 9 years, when I struggled to get a diagnosis, I would go, every year I was a good girl, and I was like, very concerned about my health. I was a pharmacy student, and I thought I had every condition, right? Because that's what you do when you're going through school. But I kept getting the same tests done, and all of them were normal. One of the reasons is that the TSH test is not going to be elevated until somebody's had thyroid disease for quite some time. The other reason, of course, was that the interpretation of the test was lacking back in the day. So we now know that most people feel best with a TSH between 0.5 and 2. And mine was 4.5, and I have this wonderful report that says your thyroid is normal, yet I was sleeping for 12 hours a night, right? And I used to call myself, those were my sloth days, right? And we also know that this condition impacts 5 to 8 women for every 1 man that's impacted. And I have a theory about this. It's my safety theory of autoimmune thyroid disease, because quite frankly, it's not safe to be a woman in our world. As the doctors were talking about, when you have a history of trauma and you have this is a potential root cause of thyroid disease, these are things that are going to set you on a cascade of abnormal thyroid hormone levels later on in life. The other thing to consider is that most people who are seeking your care are likely to have the general population statistics are 27% when you use advanced diagnostic methods like thyroid antibodies or using a fine needle aspiration biopsy to diagnose Hashimoto's. But the truth is that many of the people presenting to healthcare professionals and trying to get healthcare services, that percentage of thyroid disease is going to be much higher in them. And one of my friends, Trudy Scott, she's a wonderful functional nutritionist, and she specializes in anxiety. And she says that anywhere from 50 to 60% of her clients with anxiety actually have thyroid antibodies. So one important thing to note with Hashimoto's is that it's not like black and white. It's not like you just have it full-blown or you don't have it. There's actually 5 stages to Hashimoto's. In the first stage, for all intents and purposes, your thyroid function is normal, your immune system function is normal, and you're not going to have any symptoms, right? This is just the genetic predisposition. The second stage is when things start to change. So we start seeing an infiltration of white blood cells right into the thyroid gland. And people can start seeing changes in thyroid antibodies. So you might see thyroglobulin antibodies or thyroid peroxidase antibodies in this stage, but the TSH will still be normal. The other interesting thing is there's also seronegative Hashimoto's. So some people don't even have thyroid antibodies, and doing a thyroid ultrasound or a biopsy might be another way to find thyroid disease. But really, unless you biopsy every single cell within the thyroid gland, you can't tell if there's white blood cells in there. So It's really not something you can necessarily exclude by doing thyroid antibody tests. The other thing is, in this stage, there's just beginning attack of the thyroid gland, so the thyroid tissue may still be intact, but the body's already compensating. And this is when we start seeing symptoms. So people in this stage are going to have the panic attacks. There's multiple studies on the different types of symptoms that are correlated in this stage: obsessive compulsive disorder, panic attacks, anxiety. One of my favorite one was health-seeking behavior, hypochondria, right? And a lot of times, and traveling the country the last year or so, I've interviewed over 60 patients with thyroid disease. And through my platform, the Thyroid Pharmacist, I have over 300,000 people that follow me online, my clients and whatnot, and they all share the same stories with me, is like they were going to get care. They were trying to seek the help, but people were just telling them that there was, you're crazy, here's an antidepressant. You're just fat, you have fork and mouth disease, you need to eat less. These are true stories, right? And then that's stage 2. Now, if you can get a person diagnosed in this stage, you can prevent a lifetime of fork-to-mouth disease. You can prevent a lifetime of depression. And you can also prevent the need for thyroid hormones or thyroid medications, because you can, while we have some technologies that can reverse and accelerate tissue healing, it's much easier to prevent damage on a thyroid gland than it is to regrow new tissue. Stage 3 is when more progressive doctors are starting to diagnose people where a person will have subclinical hypothyroidism, and they will also have slightly elevated TSH, and then they will have the thyroid antibodies or not. And at this point, we start seeing more and more symptoms. We know that treating people with thyroid hormones at this stage can also be helpful. For pregnant women, this is usually a must, but in the conventional world, whenever a woman who's not pregnant comes in with a TSH, 6, 7, or 8, she's told to wait and watch. To wait and watch for what, right? For it to get worse? And so stage 4 is overt hypothyroidism. This is when most people get diagnosed, right? And at this point, they are prescribed a medication. I think we all know the brand name levothyroxine. It was the #1 prescribed drug in 2 out of the last 3 years. It finally got beat out by Vicodin last year, right? And this is something that they're getting, but many of them continue to have symptoms with this medication, and they're told, oh, well, your thyroid's got nothing to do with your hair loss, your thyroid's got nothing to do with your weight gain, and your thyroid has nothing to do with your depression. And the scariest part is that this medication is not only, it doesn't really help the symptoms that it's supposed to treat, but it also doesn't stop the progression of the condition. So we know that Hashimoto's, like every autoimmune condition, is progressive. And so stage 5 is when we start seeing progression to other types of autoimmune conditions. I've talked to so many people around the world who were good girls. They took their thyroid medications. They did everything their doctors said. And then they were diagnosed with rheumatoid arthritis or lupus or another type of autoimmune condition because the root cause, the trigger, was still there. Nobody was doing anything about it. And so just a quick summary. So people have symptoms. And a lot of times they're misdiagnosed with mental health issues when they have thyroid antibodies. And this is going to be you might not see any changes on the TSH. You might just see these changes when you do thyroid antibody tests. And so these are some of the antibodies to do for thyroid peroxidase, thyroid globulin, TSI, and TSH receptor antibodies. So going over a lot of the symptoms, we talked about some of the symptoms that can be caused. And traditionally, people associated hypothyroidism with many of these symptoms, with one set of symptoms, and hyperthyroidism with another set of symptoms. But the truth is, when you have Hashimoto's, what's happening is as the body starts to attack the thyroid gland, we start seeing a big rush of thyroid hormones into the bloodstream. And this actually causes a transient hyperthyroidism. And so you will have a person who has symptoms of both an overactive and an underactive thyroid. And I could tell you personally, it's no picnic, right? So you end up with having anxiety and panic attacks on one hand, and then you end up, once the hormone gets cleared out of your body, you might have depression, fatigue, apathy. There's a whole bunch of different conditions that can be traced back to thyroid disease. I'm not saying that thyroid disease causes every single mental health symptom and condition. Of course, that would be ridiculous. But there's a significant percentage of people who have, postpartum thyroiditis, and that presents as postpartum depression. Or they have depression that can actually be resolved when treating the thyroid gland. Bipolar disorder, there's a big percentage of people with bipolar disorder who actually have thyroid antibodies. I don't think this is really appreciated. People don't realize the effect of thyroid antibodies on the brain, except for in the case of Hashimoto's encephalopathy. But, of course, this is a very extreme case. As far as psychotropic medications go, oftentimes, I'll see, when I used to work at the pharmacy, it was like, okay, here's your birth control, your antidepressant, and your thyroid med. It was just pretty much, we had this like fast mover section in the pharmacy that was like right up front, all the medications we commonly use. And that was just like, okay, they're all right here. I can just pull them all real quickly. Here we go, right? Because commonly women will be placed on all these different medications. And a lot of times they may actually exacerbate some of the symptoms or even mask the condition. So medications that affect dopamines can actually suppress TSH. And so if a person was on, let's say, Wellbutrin, and if they were going to get their TSH tested, it may be falsely suppressed. So you might miss a thyroid condition then. We know with lithium has a very unfortunate relationship with the thyroid gland. And that's one of the really big things when you have a person on a lithium. As pharmacists, we were always taught to monitor their thyroid function because lithium can actually bring new onset thyroid disease or can exacerbate existing thyroid disease. Antipsychotic medications. So I used to be, before I became the thyroid pharmacist, I was a consultant pharmacist in mental health. And one of my biggest jobs was actually to get people off of antipsychotic drugs because of the harmful metabolic effects they had. And I can't get this statistic anywhere, but there was somebody that said that, like taking an antipsychotic drug is like eating 3 extra cheeseburgers a day, right? Because of their impact on the metabolism. Now, if you give somebody a highly sedating medication that makes them gain weight and they already have thyroid disease, like you're really not doing them much of a service. And of course, benzos and SSRIs, these are commonly given to people with thyroid disease, and they really don't help in many cases. So studies have shown, like the STAR-D trial, that these medications are not super effective, and especially if you have a thyroid condition, they're not going to be all that effective as well. So what are the helpful interventions for people with thyroid disease? Well, obviously thyroid hormones, right? And so, in pharmacology, we call T4 and medications that need to be activated into the body, into other medications, as prodrugs. And so T4, which is levothyroxine, the most commonly prescribed drug, is actually a prodrug. So it needs to be turned into, it needs to be activated in the body to work properly. And T3 is the more active version. And we see that people oftentimes will continue to struggle with thyroid symptoms when they're on this medication. So one, kind of crazy thing you can do is you can actually give them T3 directly, and that helps. That really helps some people resolve their symptoms. So people will say, wow, I started taking this medication, whether it's T3 directly in addition to the T4 or natural desiccated thyroid, but they'll say, wow, I am not changing up my exercise routine, but I'm losing more weight, and I feel better, and my hair's growing back, and my skin's nicer, and I'm not as tired anymore. Of course, it doesn't stop there. Selenium supplements. So selenium supplement can be very, very helpful for people with thyroid disease. Selenium deficiency has been identified as a big potential root cause of thyroid disease. And anywhere from 200 to 400 micrograms of selenium methionine has been shown to reduce thyroid antibodies by about half over the course of 3 months. The other cool thing that happens is a lot of times people's anxiety goes away or reduces when they have Hashimotos and their antibodies start reducing. So this is something that can be very helpful, and it's also helpful for postpartum thyroiditis. It's helpful for Graves' disease as well. Myo-inositol is also a helpful intervention for a person who has OCD-like symptoms as well as thyroid disease. They can go hand in hand. There was one study done a little while ago that showed using myo-inositol in combination with selenium helped to reduce not just thyroid antibodies, which actually helped to put some people in their remission range, but also helped to reduce TSH. And I did a survey of my readers in 2015, and I asked them about some of the most helpful interventions. And I broke it down into all kinds of classes and, what helped most for what. And these were the actual interventions that people thought were most helpful for their mood-related symptoms with thyroid disease. And so balancing blood sugar. Wow, can you see some miracles when somebody eats blood sugar stable meals, right? Gluten-free or paleo diet. My mom just sent me an article the other day, and it was like, people are on the gluten-free diet when they shouldn't be. Like this crazy woman said she's on it for Hashimoto's, and I was like fuming in my little shoes because in my survey over 2,000 readers and just in my work with clients, 88% of them feel better gluten-free when they have Hashimoto's. And what's crazy is in asking them which interventions helped most and least, and I don't have time to go through all these stats with you guys, but the gluten-free diet was actually more helpful for mood, for weight, as well as for energy, which are the top 3 thyroid symptoms people experience compared to thyroid medications. It's like, wow. Paleo diet can be very, very helpful as well. And then autoimmune paleo diet is another really helpful intervention where we see nodules shrinking, when we see people, becoming brand new people when they change their nutrition. Acupuncture, sauna therapy, massage therapy, and adrenal adaptogens. These are some of the other things that people say, this really helped my mood with thyroid disease. And so I always like to think about root causes. So sometimes, mood alterations can be caused by thyroid disease, right? But then what causes thyroid disease? And I like to look at the functional medicine approach, of course, when we look at food sensitivities. So gluten, dairy, and soy are the top reactive foods for people with thyroid conditions. Nutrient depletions, selenium, thiamine, magnesium, ferritin, as well as vitamin D are some of the common nutrient deficiencies. Chronic infections, Epstein-Barr virus, H. pylori, blastocystis hominis, various kinds of parasites, SIBO, all of these things can actually trigger thyroid disease. And in some cases, when you get a person treated for these, the person can go into remission. It's amazing. It's like, well, this was the cause, right? Of course, impaired stress response. So there's a huge connection, and I think, as everybody in this room is aware, to traumatic events and causing chronic illness, and thyroid disease is no different. Things like social rejection can actually bring on thyroid disease. There's a study of this little rat study that was done in, there was a little rat family, mama and papa rat, in their little home with their little rat children, and scientists decided to drop an intruder rat, right in that cage and see what happened, right? And of course, the intruder rat immediately got attacked by papa rat and was defeated. And then that didn't feel very, very pleasant for the intruder rat, and so they decided to measure that rat's thyroid hormones right after, and guess what? They were altered, right? Prisoners of war have altered thyroid hormone profiles, and it's anywhere from the extreme. It could be like from a Mean Girls experience in high school, or it can be from something as extreme as having trauma, very, very serious, significant trauma in your life. Of course, intestinal permeability is a common root cause, so that's something that's huge. Thyroid cells are actually made from the same fetal origins as gut cells are, and a lot of times we'll see when we address gut symptoms, we see thyroid symptoms improve. And then toxins, really simple things like getting a fluoride filter can be really, really helpful for people, and getting them to stop using their antibacterial soaps. So triclosan was recently banned by the FDA for having a thyroid hormone disruption. And I think about, poor people with like OCD and using all of their antibacterial soaps, right? And it's like a vicious cycle. So I'd love to get into with you guys a little bit deeper about everything related to thyroid disease. I have a few resources to offer. So my Hashimoto's The Root Cause book that came out in 2013, it's a New York Times bestseller. We've got thousands of patients that have now reviewed it. And this is something that you can give to them. They can take this and they'll be on board with functional medicine once they read this. So the best emails I get are from doctors that say, hey, I had a patient come in with your book and they're actually asking me to do functional medicine testing. They're actually asking me to do more testing, and like it gets them motivated and gets them on board. My new book is coming out March 28th, Hashimoto's Protocol, and then the Thyroid Secret documentary series that's coming out March 1st. And in this series, we have 9 episodes that go through misdiagnosis, they go through postpartum thyroid issues, and help take people back on a recovery to get their health back. Episode 2 is actually focused on mental health and misdiagnosis as well. So I think you guys will be especially interested in that. That's all I have for you guys, but if I could leave you with one closing thing, that if you have a person who is fatigued, who is sleeping a lot, think about their thyroid. Don't always say like this person must be depressed. Even if they are, quote unquote, having mood alterations, think about the thyroid.